The House comes to questions for oral answer. Question number 1.
Thank
in the
you,
name
Mr.
of the
Speaker,
Honourable
and
Annette
my question
King.
is to my very good friend, the Minister of Health. Does he believe that DHBs have enough funding to meet the needs of the public in a fair and equitable way?
The Honourable Dr Jonathan
Happy
Coleman.
New Year to you too. Yes, under this government, Vote Health has increased by $4.3 billion. In terms of fairness and equity, funding is distributed to district health boards via the population-based funding formula introduced by Health Minister King nearly 20 years ago.
And a very good policy too that you've kept.
Order. Supplementary question. The Honourable Annette King.
Is it a fair and equitable system when 20% of people refused a first specialist assessment under his funding are people needing orthopaedic operations? In other words, older New Zealanders living in pain and disability.
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, the member is focusing on the small percentage of people who are not getting a first specialist appointment, but the wider picture is actually first specialist appointments under this government have gone up massively by about 110,000 per year. In fact, I think it's actually even more than that. In terms of hip and knee surgery for older people, there's been a huge uplift in joint replacements over the last 8 years, from 8,800 in our first year in government to over 11,000 now. So we're doing more all the time, helping more New Zealanders getting the services that they need. The member should be positive and focus on the good things that are being done rather than nitpicking around the fringes.
Same old mantra.
Order. Supplementary question. The Honourable Annette King.
Does he stand by his statement that the answer to increased demand is to do more, when the increase in hip and knee surgery was a mere 2.7% over the previous year, and eight DHBs are doing fewer hip and knee operations than before, while the demand and need for surgery is exceeding the funding he's putting in?
The Honourable Dr Jonathan
Coleman. The Minister wants to be cheerful and focus on the big picture. Was actually hips and knees have gone up 8% over time. In terms of doing more, I agree we should be doing more. That's why I was very disappointed that when Mrs King was Minister, she managed to deliver 7,500 fewer operations each year.
Living in the past as usual.
Order. Can we just have the supplementary question, please? Supplementary question. Honourable Annette King.
When he said on the 2nd of November, eye treatment in the public health system was, quote, actually pretty good, end quote, was he aware the College of Ophthalmologists estimated that more than 100 people could lose their vision or go blind because of delays in treatment?
The Honourable Dr Jonathan Coleman.
Once again, the Minister shouldn't be so gloomy. When you're looking at eye assessments and eye surgery, let's look at the bigger picture, the facts. Ophthalmology assessments up 40% in the last 8 years. Ophthalmology surgeries up a whopping 57%. So, of course, there's always more to do, and that's what we're doing, unlike, of course, when Mrs King was Minister, when she did less.
Supplementary
question. The Honourable Annette King.
Is the hastily put together $2 million package announced 2 days before Christmas realistic, when the College of Ophthalmologists estimate that up to 21,000 people are overdue for follow-up eye appointments from the 5 main centres, and the only people who are gloomy are those who aren't seeing properly?
The Honourable Dr Jonathan Coleman.
I think a lot of, I know a lot of thought went into that $2 million package. I mean, up $100,000 for each district health board. It was consulted with the ophthalmologists, and they thought it was an excellent initiative which is going to benefit a lot of New Zealanders.
Supplementary question.
The Honourable
Was it acceptable to him to sit on his hands and do nothing, denying warnings that the college gave him a year before of the massive failures in follow-up eye treatment, and watch an estimated 100 people lose their vision or go blind on his watch?
The Honourable Dr Jonathan Coleman.
As Mrs King knows, that just didn't happen.
You don't know.
Order. Order. Question Order.